Hey guys, Dr. Morris, injury experts. So we saw a potentially significant injury for Quishon Judkins yesterday. Now I've been waiting to record this video. Usually I record immediately after it, but this one is so complicated that I actually wanted some clarification in order to really, before I put anything out, because the first video I do is usually the most impactful and there's too many different variables for this one. So we received clarification yesterday and they have not updated anything, and it's just about noon here on that Monday. Now, Judkins was going out for a pass in the backfield, kind of passing laterally from Shedeur Sanders, and he caught the ball and he was isolated really by himself, and the defender, I believe he hit his left knee or left side and tackled him. But what happened was his right leg was trying to brace or plant or whatever it was, and his leg, something was wrong with it. You could see it. Now, the play was so gruesome that they did not show a replay of it. I happened to take a photo of the play and basically highlighted what happened to his leg from afar, but it's not the best angle, and there's no other views that we had at the luxury at the time. I haven't seen any better ones since. Now, if you don't like gruesome photos, I would probably turn away. But from what we can see here, his right leg is planted laterally. Obviously not a normal position. Now, as we've seen in the past with other fractures and dislocations, the lateral ankle sometimes completely turns the other way, like we saw with Chris Godwin, like we saw with Cam Scatterbo. That was not the case here from what we could tell. So if you have a leg that is facing an abnormal angle, there's only traditionally one of two possibilities. You can have a significant injury to the knee, usually a dislocation with multi-ligament tear, think Tyreek Hill, where you tear the ACL and usually in this case the MCL, which would allow that leg to rotate substantially. The other possibility is if you have a fracture of the lower leg, usually the fibula, which is the small bone on the outside, and sometimes a fracture dislocation of the ankle, allowing that to rotate abnormally. Well, and technically you could have both or a variant of each. Now, we got an update early yesterday afternoon, and it said he did indeed have a fibula fracture and he had an ankle dislocation. So that confirms that. Now the question is, did he have a knee injury? And we've heard that there is an injury to the knee, but we haven't heard any specifics. There's nothing publicly made available about this yet. So as of right now, I'm gonna assume that the knee got lucky and he didn't have a knee dislocation like Tyreek Hill, like Tank Dell. That would be catastrophic and significant. If he had a mild MCL sprain or something along those lines, not a big deal. But if this was a full ACL tear, a full MCL tear, a significant meniscus, a tibial plateau fracture, something like that, those are significant injuries that would dramatically impact not only 2026, but potentially his future. If this is just an isolated fibula fracture, let's go with that. Now, there's two bones in the lower leg. You have the fibula, which is the small bone on the outside that only holds about 15% of the body weight, but it's important in making up the ankle joint. Then you have the tibia. That's the main shin bone. That is a very hard bone to fracture, but technically you can. And usually it doesn't happen like this. Usually it's a contact injury direct to the side, or multiple injuries in different planes, or a car accident, or falling off of a building, or something funky like that. Now, if you fracture your fibula, there's a couple different places that can traditionally happen. You can have a low fibula fracture, what we call a Weber A, which is below the ankle joint, not overly concerning, annoying, and causes problems, but not a big deal. You can have a Weber B, which is at the ankle joint line, and this is concerning and almost always requires surgery because of the instability they create. And you can have a Weber C, which is much higher up on the leg, almost close to the knee. Now, in order for the type of injury that had to have happened here, this is likely to be a Weber B or a Weber C, or he could have multiple fractures. Now, the importance and the difference between them, Weber Cs can often be accompanied by an injury to the nerve, what we call a Mason-Neve fracture, because there's a very important nerve that runs along the proximal fibula. that runs down the lower extremity. So sometimes we see foot drop with this and so on and so forth. Now, if you have a Mason-New fracture, a lot of the times you can't even tell because it doesn't usually hurt a whole lot. It just doesn't cooperate, and sometimes they even get missed. This one obviously was not missed. The other thing that's important to understand here is if there was any injury to the syndesmotic ligament, the high ankle ligament. Now, if the high ankle ligament was compromised, that's going to delay this recovery. Why? Because the high ankle ligament is responsible for bringing the tibia and the fibula together. And if those are not together, then the ankle joint at the bottom, which does not have a lot of wiggle room, a lot of play, has a lot of issues. And if that fibula decides to ride laterally, then you're going to have a lot of instability, a lot of pain in that ankle joint. And that's probably what happened to Chris Godwin earlier this year, why he required a second surgery and why he actually had a re-injury mid-season. Now, if we were to compare this injury to Quishon Judkins to, say, something like Cam Scatterbo, they're similar, but Scatterbo's was technically worse. Why? Because Scatterbo's reportedly actually had a fracture through the skin, which is substantial and can be significant long-term for infection issues. That is apparently not the case here with Judkins. Now, if this is a simple isolated fibula fracture and ankle dislocation, the next question you have to ask yourself is there any injuries to the ligament in the ankle? Traditionally, we will injure the medial aspect, which is the deltoid ligament. It's really a complex, which is a substantially thick and important ligament, which is the reason why almost all of our injuries are to the lateral ankle, because that ligament is so strong. Now, if that ankle is injured, and I think that's what happened with Godwin, sometimes it has to be reconstructed or repaired, and that would allow the ankle to rotate laterally. Now, it wasn't super clear if Judkins' deltoid injury was part of it or not. So you can see there's different levels to it. Was the knee involved? Was the nerve involved? Was the ankle joint involved? Was the syndesmotic ligament involved? Was the deltoid ligament involved? There's a lot of different moving parts here. But from what we've heard, this may be what we call a best case scenario, which means that this would be an isolated fibular fracture, potentially causing an ankle dislocation, but no substantial injuries to the ankle joint, to the ankle mortise, or the syndesmotic ligament, and no injuries, significant injuries to the ligaments or substantial injuries to the knee. In that case, he would be potentially back probably by OTAs, so think 4 to 5 months from now, and this would really not impact his career at all. Everything would go forward like nothing ever happened, which would be really, really impressive. Now, if the syndesmotic ligament is involved, we're going to have a situation like Tony Pollard or like Isaiah Pacheco, who really struggled in the years after. So these are different things that you have to understand, have to compare. This is not black or white. These are shades of gray, and we rarely get all of the details. We don't know who's performing the surgery or when it's being performed. I don't believe it's been performed yet, because if it was, they usually would have announced that, and it hasn't been announced yet. When I have more information, I will give you more, but as of right now, that's the initial thoughts on Quishon Judkins heading into 2026, as his, unfortunately, 2025 was cut short, but potentially good news that this will not impact his long-term overall health and value, although he will have some arthritis in the ankle later on in life, but in the long run, this could have been significantly worse. Let's hope for the best and hope this was more of a mild situation as opposed to something like a Chris Godwin or potentially worse. I'll give you more when we know more, but as of now, I'm Dr. Jesse Morse for the Injury Experts.